with Equitable Life and Casualty. Would like to thank all of you for joining us here today for our EquiCash Hospital Indemnity webinar. We are coming up on AEP very rapidly in about, 12, 13 days. We're going to be starting into the enrollment season for 2014. So need everybody to make sure they have all their certifications in place and up to date, and make sure you take a good look at this product. We're going to talk about some things today about the hospital indemnity program through Equitable Life and Casualty that will help put additional income in you and your family's pockets, and also help you make your client who enrolls in a Medicare Advantage plan a much more rounded product. So if you have any questions as we move through here, I have Gershon Georges on the other end of the webinar. You can text or type those questions in to her, and she will answer those as we move through this product, and then we will bring those up again at the end and try to get all your questions answered and get you out and let you finish up your week. So let's go ahead and get started. The states in which this product is available, on the map there in front of you, it's very, very broad coverage of the country. We got this in just about every state outside of California and Florida, the two big states, and there's a few up in the northwest corner or northeast corner of the country. But if you are listening today from Florida, we also have this product available on our sister company paper, Heartland National Life, and Florida is our biggest state for this product. I was just talking to a big agency owner down there, and so far year to date they have produced over $2 million of this product on Heartland National paper. So if you're listening from Florida, we also have you covered there, and you're not contracted, please give us a call at the end of the webinar and we'll get you set up and ready to go. Okay, talk a little bit about why we developed the Secure Advantage product line. We want to talk a little bit here this morning about where this product fits, and tell you a little bit about why we developed the EquiCash product line. When I started selling Medicare supplement insurance back in 1984, and we wrote MedSup, final expense, cancer plans, and a little bit of short-term care products. So with Medicare supplement, you know, Medicare Advantage wasn't even available back then, so you built this, you get residual income off of that. You build up a really, really big residual income, and then back in 2005, here comes Medicare Advantage through the Affordable Care Act, and we're thinking, I'm going to lose all my residual income, because I lived in Saline County, Missouri at the time, Marshall, Missouri, and I'm thinking I'm going to lose every penny of my residual income that I've worked 20-some years to build up. What I found, though, is not only did I not lose my residual income, it continued to grow, because as you all know, if you've been in this business for any length of time, the last 3 months of the year are, generally speaking, and maybe January in there, are the biggest production months for all insurance companies in the senior market. So not only did I not have my residuals go down on my MedSup, they went up. It also created a huge opportunity for myself and other agents that are still out selling to add this product line to their portfolio. Now, why do people buy a Medicare supplement insurance? Because original Medicare Parts A and B have deductibles, co-payments, and co-insurances. So doesn't it make sense to you and I as salespeople in the sales field, if we take our client from Part A and Part B of Medicare and put them in Part C of Medicare, we're not taking them out of the Medicare program, we're just changing where they fit into the Medicare program, we're putting them in Part C. Doesn't it also make sense to you and I that if we do that and put them in Part C of Medicare, that probably that product also is going to have deductibles, co-payments, and co-insurances, and out-of-pockets. So that's why we developed this product, and primarily where it fits is with a Medicare Advantage plan. We also have some agents out there adding it on to high-deductible major medicals. I think you're going to see a lot more of that with Obamacare. People's premiums are going to go up. The only way they're going to be able to keep paying those is they're going to probably raise those deductibles higher and higher, and for a small amount of money for somebody over age 50, they can add $300 to $500 a day to offset that additional exposure when they go into the hospital. So it'll fit in there, but primarily for what we want to talk about here today, this product does fit side by side with a Medicare Advantage plan. We get asked a lot in today's economy, is this an affordable option for people on Medicare? And that answer would have to be yes, for the simple reason, I'll give you a couple of different examples right here. Let's say that you're sitting there talking to a man and a woman who have had Medicare supplement insurance with you for quite some time, and they are generally concerned about the continued rate increases on maybe a Medicare supplement, and they're on a fixed income, and they say to you, well, Bill, I just can't keep paying these rate increases on my Medicare supplement plan. We are in a very tight income. We're going to have to do something different. So when I hear something like that, or when you hear something like that, you can either try and find them a cheaper plan, and maybe you can't find them a cheaper plan, or maybe their health's changed and they can't get out of that plan. Then you should think about a Medicare Advantage plan, for the simple reason there is hardly no underwriting to a Medicare Advantage plan. There's one health question, and that's kidney dialysis. So you know health-wise, you can go ahead and get them insured under an MA plan, and then you can either walk away from the maybe $400 a month they're paying, or maybe they're paying $400 now. Do you leave all that money on the table, or do you come back and for about $60, $70 a piece, less than $150 total premium, and add a more rounded hospital plan to offset some of their high co-payments and deductibles on their MA plan? So definitely this is an affordable product. Also, and I'll give you an example of some of the things that I ran into when I'm out in the sales field. I get a lot of referral business, and a little while back had a lady from Marshall, Missouri insured, and her son-in-law was turning 65. He lives in Overland Park, Kansas, and I can't remember Tracy's last name, but when I sat down with him, he was already paying $450 a month for his major medical plan, and it had a $2,500 deductible, and it had a co-payment of $30 at the office, and it had a co-insurance of 20% all the way to $10,000. So another $2,000 out of pocket should he end up in the hospital with any major illness. So I showed him a Coventry Medicare Advantage plan because that's what he was interested in. It carried 0 premium, but it did have I'll show you the rates here or the benefits here shortly. It had a $250 per day copayment when he went in the hospital, and I showed him the EquiCash plan, and I walked out of there with a first dollar or a new commission on the MA plan, which it was brand new, so it's fully commissionable. And I wrote him a hospital indemnity plan for about $68. So was that a good deal for him? First off, he was paying $450. He's now paying $68. That's a win-win for him. He went from a $2,500 deductible down to $250 per day for his MA plan. So the HI offset that. So that was a good situation for him. And then I put another benefit on there called a cancer rider, and I'll show you that here shortly, and I'll go through that on a step-by-step scenario with you to show you how to do that. But so definitely when you're stopping and thinking about this in today's economy, is this an affordable product? Absolutely. You get certain scenarios, this is a slam dunk for you, and it's up to you and I to present it and not walk away from that additional income laying on the table. So what's in it for you, the agent? What I did, guys, gals, is I just took a 65-year-old male or female, the rates are unisex, and I started out with $200 per day, and I added a $10,000 lump sum cancer rider to that plan. That came up with a monthly premium of about $62.80. If you take that times 12, you'll come up with an annual premium of around $700-800 and about a street commission of around $452. So stop and think about that. We're coming up on MA season. If you could just do this 2 times a week, you could put an extra $900 in your pocket for you and your family going into the holiday season. But if you could do 2 of these per week for 1 year, you would increase your commission by around $45,000. And guys, I'm not asking you to stop what you're doing and do something completely different. All I'm saying is you should be adding this to your additional portfolio because you will run into these types of sales throughout the year. Okay, so that's what's in it for you, the agent, on the commission side or the income side, and what's in it for your client is you round out their portfolio, their product portfolio, and give them a much better benefit package. So then last but not least, how do you present the EquiCash product? What I did about, oh gosh, 3 years ago is I sat down and I created a presentation that's very, very simple to use, takes about 5 minutes to do, and if you will follow my guidelines, you don't have to do it word for word or step by step like I do it, but if you will take what I have put in front of you and use it, you will find that every time you do this scenario, you should close every 6 people out of 10 that you sit down and talk with. So if you're talking to 10 people a week and you're getting 6 sales off of this a week, stop and think about that income example we just looked at a few minutes ago and think of what is possible just by this line of product. Okay, so before we get into that, first off, let's review the EquiCash product. We have 3 benefit levels in most states. There's a few states that, you know, I don't have time to go through every one of these on a per state basis. So if you have questions about what's available in your state, you can always get on our website, www.equiline.com. That's the agent website. Go to your state, click on the EquiCash product, and it will show you what levels are available in your state. Primarily, though, in every state, these 3 levels are available. In Florida, all we have is the gold and platinum. That's the way Florida made us sell it or file it. In Utah, gold and platinum. That's the only way Utah would approve it. So, but in most states, we have the silver, we have the gold, and we have the platinum. So for this webinar today, we're going to talk a lot about the silver benefit, and then we will buzz through the gold and platinum. The benefits are a little bit more rich on those 2 plans. Okay. So the daily hospital indemnity on this plan starts out at a 10-day maximum benefit period for each period of care. Your daily benefits run from $100 to $500 per day in $50 increments. The durable medical equipment is $200 per occurrence per calendar year. The ambulance benefit is $100 per occurrence with a $2,500 lifetime maximum. The emergency room is $150 per visit following an accident, injury, or sickness. It doesn't say that there, but we're refiling all the forms to include sickness. We've been paying for sickness for ever since this product was filed. So if you have somebody that goes into the emergency room with a sickness, not an accident, they're still going to get paid. We'll cover that shortly. The physician's benefit is $25 per visit with a $75 calendar year maximum following a hospital stay. What I do, guys, gals, I always underline real heavily with an ink pen for follow-up after a hospital stay, or if it's one of the days that I didn't walk out of the office and I have my highlighter with me, I highlight for follow-up after a hospital stay. You want them to realize that $25 is after they come out of the hospital. If you've ever had a loved one or a family member or a friend in the hospital, one of the last things the doctor says to that individual that's hospitalized is, Bill, I'm going to go ahead and let you out of the hospital today, and I want to see you back in my office next Tuesday to make sure everything's going fine. So that's what that benefit's made for. Then we also have the optional lump sum cancer rider at the bottom to where you can add $1,000 to $10,000 in $1,000 increments upon first diagnosis for cancer. So excuse me. Let me back up and cover how this really breaks down to us in the field, because guys, what sets us apart from a lot of the other products on the market is how we pay claims. You guys need to be aware of this. This is very, very powerful when you're out in the sales field if you're competing against the competition, because we do things a little differently. We want your clients to be happy. So let's start with the daily hospital plan. What defines a benefit period of care? A period of care under our program is defined as 30 days must separate their discharge from the hospital to their re-entry to the hospital. So if you had someone out there that had been in the hospital for 7 or 8 days and they got out 2 weeks ago and went back into the hospital before that 30 days had expired from their discharge, they would have 2 days left in that benefit period. However, if you had somebody that had used 8 days of their benefit period, or 7, whatever, and they had been out of the hospital for more than 30 days and went back in the hospital, they would start out at day 1. Again, if you have any questions on this, shoot those questions in and we'll get them covered at the end. So that separates us from the competition in one area right there. We're 30-day separation. Most other plans are 60 days, has to expire before a new benefit period starts. Durable medical equipment, that also is an indemnity benefit. It's $200 per occurrence per calendar year. The way that would work is, say they left the hospital and they had a DME, a durable medical equipment expense, and after the MA paid, their co-payment was $60 or $100. Once we get that itemized bill, we will still pay out $200. We don't just pay up to the bill. This is an indemnity product. They're going to get a check for $200. The ambulance benefits, $100 per occurrence. That's air or ground. If you stop and look at most Medicare Advantage plans, the ambulance is usually $150, so we're coming up a little light right there. However, where does the ambulance take you? They take you to the emergency room. Most MA co-payments for the emergency room are $65. We pay $150 for the emergency room visit, so we've paid $250 on about on $215 for the charges. So there's enough right there to pay that with a little left over. Now, I want to spend just a little bit of time and talk about a couple of different scenarios as how this would play out should your client end up in the hospital or the emergency room. So let's say you have a client that sitting around the house and they're getting really bad pains in their chest, and they think maybe they're having a heart attack, so their wife drives them to the hospital or to the emergency room. The doctor runs all the tests, and at the end of the test, he comes back in. He says, "Bill, I don't think there's anything wrong with you. I've run all these tests. Can't find a single thing wrong with your heart. I'm going to go ahead and let you go back home." Now, this is a hospital indemnity plan. Would you think your client should be paid for that? They were not admitted to the hospital. I assure you, if you look at all the competition's plans and that scenario happens and they go to the emergency room for a sickness, number one, which we will pay, they will not. Theirs will say accident or injury. We will go ahead and pay that claim. So you don't have to worry about getting that nasty phone call from your client saying that the policy didn't pay anything. We're going to go ahead and pay that. Sickness or accident or injury, they're going to get paid. So to take it one step farther, say that the person is sitting in their house and something happens and they feel like they need to get to the emergency room, but they can't drive and they're single, so they have to call the ambulance. Now your ambulance comes by and picks them up, and the ambulance takes them to the emergency room, and while they're in that emergency room, the same thing happens. They say, you know, can't find anything wrong with you. We're going to go ahead and get you, send you back home. We will still pay both of those benefits even though they were not admitted to the hospital. The competition will deny that claim and tell your insured that you were not in the hospital, no benefits are payable. But guys, take it one step farther. The ambulance comes and gets your client. The ambulance takes your client to the emergency room, and now the conversation goes something like this. Bill, I've run all these tests. I don't think there's anything wrong. However, I'm not 100% sure. I'm going to go ahead and put you in the hospital tonight. If you're doing better, you know, by noon or early tomorrow afternoon, I'll go ahead and let you go home then. But I'm going to go ahead and put you in the hospital tonight. What does your client think in their mind? The doctor just put me in the hospital. Now, do you think your client expects to be paid? You and I both know the chances are that will not be billed as an inpatient hospital stay. That will be billed as an observation stay. I just went to the Medicare Supplement Conference in Phoenix, Arizona about 3 weeks ago, and this was observation was a topic of discussion at some of the meetings. You can be in an observation unit 3 days. Now, I assure you, if your client's in the hospital for 3 days, they're in their mind, and you'll never convince them otherwise, that they were an inpatient in that hospital. That can still be billed as an observation bed. How would you like to have that situation and get a letter from the insurance company saying you were not an inpatient, you were an observation, no benefits payable? If that happens, we do pay observation units. We have been paying them for over 3 years. We're going to continue to pay them because we want to eliminate that ugly phone call that you will get from your client telling you, Bill, that policy you wrote me, I was in the hospital out here 2 days the other day. They said I wasn't in the hospital. It's not worth the paper it's wrote on. I'm going to cancel it. And they will. But guess what? What if they sent you to their sister or their brother? You think they'll call them and tell them to cancel it too? Absolutely. We have eliminated that from your way of doing business. You will not get that phone call from your client. We will pay observation stays. We will pay the ambulance and emergency room even though they're not hospitalized. So guys, gals, that is a huge difference in these products. I'm not saying Guarantee Trust is a bad company. They're a great company. I'm not saying that any of these other companies that are selling hospital indemnity plans are bad. That's just the way they pay benefits. We want your client to be happy, because if they are happy, they will continue to renew that product, and if they renew that product, you get paid residual income, and that makes you and I happy. So big major differences in the way these plans are paid out. Now, I want to take just another minute before I move on here to talk about the optional lump sum cancer rider. I see a lot of business come through without any cancer benefits on it, and I, for the life of me, do not understand that. I understand that if you present it and they decline it, that's on them. But I don't think a lot of agents really are pushing for the lump sum cancer rider, and that's the thing that really disturbs me, because cancer is rampant in this country. Everybody knows somebody that has cancer. Everybody knows somebody that's been affected by cancer. It could be in your family. It could be in your circle of friends. But I assure you, somebody out there knows a person who has had to deal with cancer. My daughter has had a malignant melanoma. She's got about a 6-inch scar in her shoulder. The owner of our company's fiance has breast cancer, has had breast cancer about 5 years ago. She's been free for over 5 years now. It's a great thing. But everybody knows somebody's got cancer. Now, let me just give you a couple of ways to present the cancer rider, and maybe it will help you guys in your presentation and get some of these policies sold with the lump sum cancer benefit on there. Again, all we have to have is the pathology report to say, yes, it's internal cancer, and the benefit check goes out for that immediately. Now, the guy that I was telling you about, Tracy, that I wrote the hospital indemnity plan and the Medicare Advantage plan on, here's how this transpired. After I had went through the hospital or the Medicare Advantage plan with him, I immediately started talking about other options for him, and we went into the covering the EquiCash plan, and he liked the idea. He'd already knew something about it because his mother-in-law had it. But when I got down to the optional lump sum cancer rider, which was going to cost him about $29 more a month, he could see the brochure right here, and he could see it says optional. He asked me, he says, Bill, do I have to make up my mind about that today? And I simply said, no, you don't. I said, but before you make that decision, let's take a look at some facts here, and then you can make your decision. I said, it's totally up to you, but I want you to understand what you are getting for what you're paying. So, guys, I'm a big legal pad user. I use my legal pad when I sell. I think it's important that people get to see examples of how things work. So what I did is I turned the legal pad around. I handed him the ink pen. I said, I'm going to give you some numbers here, and I want you to write them down. So the first thing I had him write down was 29 times 12. While he was writing that down, I said that equals 348. I said, now, I want you to take 10,000 and write that on the paper, and I want you to divide that by 348. While he was doing that, I said that is right at 28.75, so just round it up to 29. And I asked him, I said, do you, Tracy, understand what 29 represents? He said, well, I think I do, but he said, go ahead and tell me. I said, well, the 29 represents the number of years that you would have to pay that $348 a year premium for the $10,000 lump sum cancer rider. So what that means is you would be 94 years old before you would pay more into it than you would get out of it should you have cancer sometime in your lifetime. And I said, Tracy, men over age 65 have a 1 in 2 chance of having cancer sometime in their lifetime. I said, simply put, do you think there's, with those type of odds, that there is a chance that you might have internal cancer in the next 29 years? He said, well, yeah. He said, with those odds, he said, probably does. I said, well, Tracy, when you look at these numbers, I simply think this is in your best interest, don't you? He said, never thought about it that way. Go ahead and do it. Guys, true story. I actually went back about 3 months ago and wrote his wife the exact same plan. She turned 65 3 months ago. So that's one way to put this cancer plan out there. Use some numbers. Men have a 1 in 2 chance of getting cancer sometime between now and the end of their life, or 65 and the end of their life. Women have a 1 in 3 chance. I always thought it would be higher for women, but it's actually higher for men. So use those statistics. It's in our brochure when you go out and look at it. Point that out to them. Let them know the odds of it, and then break the premium down to the ridiculous by the benefits they're getting. It's a very, very, very successful way to close that cancer rider on this. Another thing that you can do to kind of help you think out of the box on the cancer rider is a lot of the cancer drugs that people get are if you go through the tier 1, 2, 3, and 4 drugs on our MA plan or the standalone drug plans, they're considered specialty drugs. Most times they end up going to pay 33% of those out of their pocket. That's going to shove them through the donut hole extremely quickly. Even if you put a $5,000 cancer rider on there and explain it to them that way, if they get cancer and they get on some of these very expensive medications, that's going to throw them into the donut hole. This lump sum cancer rider will actually help offset that pain. Now, just as an example, it's actually another true story here for you. I had a client, Jan, can't think of her last name, Niblock, called me the other day. One of her good friends that I had sold this plan to had turned down any cancer benefits at all and was having to pay some co-payments out of her pocket, and pretty heavy. She called me and she said, you know, when you were here you wanted me to do 10 and I only done 5. She said, can I increase that? I went over and done that about a month ago. So, you know, just for her picking up the phone, I made another couple $100 for just adding another $5,000 on there. So present it, you'll sell it. It's a great benefit. If you have any questions or need me to help you in any certain way, I would be more than happy to do that. Okay, moving right along, guys, to the gold level plan. Basically, all the benefits line up just like the silver. They just go up a little bit. The daily hospital benefit starts at a 20-day maximum, again, up to $100 to $500 increments and $50 slots. The durable medical equipment goes from $200 to $300. The ambulance goes from $100 up to $150. The emergency room is up to $200, and then you have your bottom 2 visits or benefits, the $25 per visit after a hospital stay, and your optional lump sum cancer rider. So we see a lot of this product coming in, gives a little bit better, more benefit rich, and gives the client a little bit more bang for their buck. So then we have the gold or the platinum. Again, it's just like the gold and the silver laid out benefit-wise. They're just higher benefits. You got a 90-day maximum benefit period. Durable medical equipment moves up to $400. The ambulance is up to $200. The emergency room moves to $250, and then you have your $25 follow-up stay after a hospital visit and your optional lump sum cancer rider. So a very simple plan. If you return each one of these little brochures over, they would have the rates printed on the back of them. I'll show that to you here shortly, and cover some changes that we made just recently about the age limits on this plan. Before we get there, though, let's talk a little bit about the personal information on the application. Pretty simple application to fill out, only a couple of quick pages, name, date of birth, city, male, female, their age, and then you drop down to Part 2 benefit selections. You have to select gold, silver, platinum, or if it's a state that only offers gold and platinum, you check one of those 2 boxes. Are you replacing anything? Yes or no. If you are, you have to complete a replacement notice. It's a very simple form. And then move over to the center where it says hospital daily amount. Need to put something in there so we can match premium with benefit, and then how many dollars of cancer benefits are you putting on there for your client. Move right along then into the application. The application's a yes/no application. It is a very, very simple app. It's very straightforward. You guys need to do a very good job of underwriting this. Sometimes if you don't follow up with some of their answers, you may miss a sale. I'll show you what I'm referring to. But look at question number 1. Right above that it says, please check yes or no beside each question. If the answer to any part of this section is yes, then we know you can't write this plan. Okay, so have they had internal cancer, leukemia, melanoma, Hodgkin's disease, or lymphoma in the last 2 years is what we're asking here. To answer that yes, you know you can't go any farther. However, if they say to you, well, Bill, I had cancer, it's been about, I think it's been just a shade over 2 years, then you need to start digging. Did they have surgery? Was there any chemotherapy? Was there any radiation? If there was, you got to have the last date of their treatment. If they can say, well, it's actually been 2.5 years since I had my last chemotherapy treatment, check no and move on. So that's what I'm saying. When you get any question that's questionable, dig in. Do they have any complications of diabetes? Well, they may not think they do, but you need to ask, have you had neuropathy? And explain to them what neuropathy is. Any tingling in the feet or the toes? Do you have any eye damage? Have you had diabetic retinopathy? Do you have any type of kidney disease or problems because of the diabetes? Are you taking more than 50 units of insulin per day? Sometimes you will say, are you taking more than 50 units of insulin per day? And they said, no. Are you taking insulin? Yeah, I'm on it. How many units? Well, I'm taking 35 in the morning and 20 at night. Well, neither one of those equal 50, do they? But the combined is 55. You're out of luck. You can't issue that plan. So dig in, do your underwriting. Don't just take their word for it. When you get a yes, no, or a questionable answer, keep going until you get down to the exact situation. Go down to question number 2. In the past 12 months. Now in question 2, we're asking in the past 1 year. They've been in a nursing home or in a wheelchair or confined. We need to know the answers to that. Have they had any type of home health care? Maybe they just had a hip replacement 6 months ago, and 2 months ago they had home health care. If that's a yes, you can't go any farther. Then go down to question 2B. In the past 12 months, have you been hospitalized 2 or more times, or been advised to have surgery is not yet completed? So the conversation goes like this. Well, yeah, Bill, I was out here at St. Luke's East about 3 months ago. I was in there 4 days with pneumonia, and about 3 or 4 months before that, I was out to St. Luke's and they did cataract surgery. Well, that tells you and I what? Number one, cataract surgery is not an inpatient hospital stay. But in their mind, to be completely honest with you, they're saying, yes, I was out in the hospital, I had cataract surgery. We know that's an outpatient. Dig in, get the correct information. In that situation, yes, you can move on. They can answer that no. So make sure that you dig in and get the correct answers and you don't shoot your foot and miss a sale when you could actually get one. Okay, then you go down to answer only if applying for first occurrence cancer riders. In the past 10 years, we're asking about internal cancer right now. Have you been diagnosed as having or been advised to seek treatment for or receive medication or been treated by a medical practitioner for internal cancer? I'm not going to, lymphoma, all the other stuff that goes with it. So they say, well, yeah, of course, if you, in the first example, if you were talking to them and said it's been about 2.5 years since I had internal cancer, then you know right then and there you can't answer that question yes or no. You know that's going to be a yes answer. So that means all the questions in 1, 2, and 3 were no, but you know the first question in 1 and the second section is yes. You can go ahead and issue the base policy, but you can't put the lump sum cancer rider on it. But if they say, well, I had cancer, it's been about 15 years ago, have had no treatment since then, at that point, you can write the full boat. You can go ahead and promote that cancer benefit to them. So make sure when you go to the underwriting section that you guys do your part and do the field underwriting, and we will have a lot of happy clients out there, and you won't have any problems. Any questions, again, go ahead and send that out, and we will help you any way we can there. Okay, then you're going to move right on along to the premium section. On that premium payment section, it says right there, payer, if not the applicant. If a payer is the applicant, you don't need to fill out the name, address, and city again. We've already got it on the front page. You can move right on down to the initial premium paid. Let's say your premium was $70 or $50 a month, and then right below that it said that must include a one-time policy fee of $25. So your first check, you do not have to pick up 2 checks, one for the policy fee and one for the premium, would be $75. You pick up 1 check for the premium and the policy fee. Just let your client know that next month, once your first draft goes through, it'll only be $50, not $75. Now, a huge thing you see right there where I just highlighted that, I never pick up 2 months for a monthly bank draft. That sometimes will cause you to lose a sale if you tell them you got to have 2 months premium. We don't require it. We won't pin your business. We won't call you on the phone or send you an email saying, hey, Bill, go pick up that other month's premium before we send this policy out. That's not going to happen. I just draw one line through there like what you see, and I write 1 month right out to the side and check that box. And I move right on down below that where it says renewal, bank draft. Is it a checking or savings? I usually, 9 times out of 10, it's going to be checking. So you check that. You fill in the bank routing information on the lower left-hand portion of the check. Get that and their bank account number, and select a bank draft date. Verify that with your client. Check the I authorize bank draft payments if you're doing a bank draft, and you're good to go. Now, if you have any special instructions for us in the home office, right above select bank draft day and about 2/3 of the way down on the lower right-hand side of the application, you see that big white area right above select bank draft day. Write your instructions right there. Say that I'm with a client today. This is what the 2nd or 3rd day of October. I think it's the 3rd. If I wanted, say my client said, well, Bill, I'm going to give you a check for $75 a day, but can you not cash that until the 15th of the month? Write it down right there. Say, do not cash check until 10/15/13. And we will hold that and make sure that we do that. If you leave it blank and the client told you something like that and you didn't put it on there, then we're going to go ahead and cash that check. So if you got special instructions, write them down and we will work with you to get your business out the door quickly. Okay. Everybody knows what this is if you're doing any type of certification for Medicare Advantage coming up October the 15th. This is a scope of appointment form. I'm not going to spend a lot of time on it. I've got a couple of things blown up there that stand out, the hospital indemnity products, and the day that form was approved, about June the 12th of 2012. I've been using a form almost identical to this since November of 2010. Been a lot of discussion out there. Can you cross-sell a hospital indemnity plan with a Medicare Advantage plan at the same time? That answer is yes, and has been yes for about 3 years now, or 4. In your compliance, it says cross-selling of any non-health related product is prohibited. And then it gives you examples like life insurance or annuities. Those are prohibited. You can't do it. You got to come back 48 hours. But if it's disclosed on your scope of appointment form, you can do it right then, right there. So if you have any questions about this scope or you don't have a copy of that, let us know. We can get that to you. But you definitely can sell hospital indemnity plans at the same time you present a Medicare Advantage plan. Got to do it properly, though. Okay. From here out, I'm going to talk a little bit about how to present the EquiCash Hospital Indemnity Plan. It doesn't matter if you're selling Coventry, United Healthcare, Humana, Essence. All those products are federally regulated on the summary of benefits. When you come to number three, it doesn't matter what company it is going to talk about inpatient hospital care. In your center column, it will tell how Medicare corresponds with the current MA plan that you're presenting. As you can see, this one's a couple years old. They haven't changed. Coventry over on the right-hand side, this is a Coventry PPO plan. As you can see over on the right-hand column there, it says the Advance for Freedom PPO at the very top of where it says in and out of network. So I'm blowing up this portion because I want you to see where it says how the current plan that you're presenting would correspond with number 3 if they go in the hospital. So in my example here, I'm using Coventry. It's a very good product here in the Kansas City area, one of the most popular, got a great network. Days 1 through 7, if they go in the hospital, they got to pay $215 per day. So when I'm sitting there with Mr. Jones, I say, now, Mr. Jones, if you're in the hospital, days 1 through 7, you're going to have to pay $250 per day. Guys, I'm a huge legal pad guy. I told you that earlier. What I do when I'm going to this portion of my presentation, I've got my legal pad out, and I've created a You Pay column. So in that You Pay column, my conversation is going to go kind of like this. Well, now, Mr. Jones, what that really means is if you're in the hospital for 7 days, you are responsible for $1,750. And I write that in right under my You Pay column. At that point, I say, now, Mr. Jones, I don't want you to really worry about that. I'm going to show you why that's not going to affect you. You're not going to end up paying that. Now, don't let me forget it, okay? So I'm starting my summary of benefits review presentation, whether it's a review of what they currently have or if it's a new product I'm presenting. What did I just create there? I created a large sum of money that he's going to have to pay. I didn't create it. It's the truth. If he's in the hospital for 7 days, he's going to have to pay $1,750 out of his pocket. And then I told him, don't even worry about that. Don't be sitting there thinking about that. I'm going to show you why that doesn't affect you. And then I told him, you got to remind me because I'm a talkative guy and I'll forget it. So don't let me forget it, okay? And then I move right on through that summary of benefits until I come to number 14, which is, again, the ambulance benefit. Doesn't matter, again, which company you're selling. It's always the same. You're coming to the ambulance benefit. And I say to him, I say, if you end up in the ambulance, you're going to end up paying another $150 copayment out of your pocket. I said, that ambulance is going to move you right into the emergency room, and that copayment is going to be $65 for you to pay out of your pocket. And then I say to him, again, Mr. Jones, don't worry about paying the ambulance or the emergency room. That's not going to affect you. That I'm going to show you a way to get around that, and don't let me forget it. Now, you see, guys, I'm not reading it right off the script. I'm saying things that work with my style of selling, and the same as you can do. But if you follow this track, it will lead you to the train station at the end. So pay attention to how this is done. Use it. Ask questions. Anytime you need me, let me know. I'm always available. I will help you any way I can. But now, guess where I write the 150 and the 65? I write that right below the 1,750, so now there's 3 charges on that you pay column. I move right on through the summary of benefits till I come to number 18. And on my legal pad at this point, since most MA plans are 20% of the covered items for durable medical equipment, I draw an example out to the right of the you pay column, and I'll start out and I'll write total on the legal pad. And I'll write 1,000 under there as the actual bill, and then I'll write Medicare approved right off to the right of that, and I'll say 500. And then I'll just, to keep him into my presentation, I'll say, now, Mr. Jones, guess which one of those Medicare will only pay their 20% of, or they're going to require you to pay 20% of one of those 2 figures. Which one is that? He said, well, probably the lower one, and if they struggle, I help them. And I said, that's correct. I draw that 20% under that 500. That's another $100 copayment for him to pay. I draw it, put it right over under the hospital copay, the ambulance copay, and the emergency room copay. So now I've got about $2,065 worth of benefits for him to pay out if he's in this situation. And I simply say to him, now, Mr. Jones, don't worry about this charge. Again, I'm going to show you why that's not going to affect you. I go completely through the summary of benefits. I go through the tier 1, 2, 3, and 4 drugs and tell him how the copays work on that. When I get done with the summary of benefits, I simply shut it up, fold it up, and I pause for just a second, and I say to my prospect, Mr. Jones, now that's how your current plan works. Do you have any questions? What do you think Mr. Jones is going to say? I've already told him several scenarios it's going to cost him money, and I've also told him not to worry about it, to remind me of it. Mr. Jones is going to come back to you if you've done your job properly. He said, well, yeah, Bill, he said there was all these co-payments. How am I not going to end up paying him? Well, Mr. Jones, I'm glad you reminded me of that. I was getting ready to move on to something else. And now, guys, the hardest part for you and I when we're cross-selling is how do I go from first product to second product, point A to point B? You got to have a transition phrase. This transition phrase is so easy for you to learn and so effective to throw you right into the Secure Advantage presentation. The transition phrase simply goes like this. Mr. Jones, when we first started selling Medicare Advantage plans back in 2005, with an effective date of January the 1st of the following year, 2006, nobody, sometimes I'll say including yours truly or including me, knew how those benefits were going to be paid out. These were brand new plans. So what we found after a couple of years, we noticed our clients were paying a lot of money out of their pocket when they ended up in certain situations. Let me just ask you a couple of quick questions. I have 10:45 on the clock. This is how quick the Secure Advantage presentation goes. Let me just ask you a couple of quick questions. Mr. Jones, have you ever been in an ambulance? And I let him answer that question. Doesn't matter if he says yes. It doesn't matter if he says no. Your response will be virtually the same. So, Mr. Jones, have you ever been in an ambulance? Yes, I have. Well, Mr. Jones, where did that ambulance take you? Or if he says, no, I've never been in an ambulance, then I would say, well, Mr. Jones, if you were in an ambulance, where do you think they would take you? Invariably, guys, they'll say to the hospital. But I always say to them, once they say that, I say, well, I understand that, but what part of the hospital? Well, they're going to take you to the emergency room. That's correct. Now, Mr. Jones, what you just did is you just triggered 2 comas to your Medicare Advantage plan, and I point to the 65 and the 150. I say to him, now, Mr. Jones, one of 2 things are going to happen when you're in that emergency room. They're either going to stabilize you and let you go back home, or what else will happen? At that point, he'll say, well, I imagine they're going to put me in a hospital. And I agree with him, and I say, that's correct. I said, they're going to admit you to the hospital, and that's going to trigger the most expensive part of your Medicare Advantage plan, $250 for each day that you're there. Now, at that point, I simply turn this brochure over. You remember you seen the front of the brochure, the Secure Advantage Silver Plan. This is the back of it. I say, well, Mr. Jones, that's exactly right. That's why we created this program. And I simply turn that brochure over. I show him where he's at in the age cycle, and I start fitting it into the budget from where I found out he was at previously. Maybe he's coming off of a hospital, a major medical plan, paying $400 or $500 a month. So he's 64 years old. I follow that over to $300 a day. If he's been used to paying $300, $400 a month, do you think he can afford $42.10 for this benefit package? Absolutely he can. And then if you go over to the far right of that box, follow that 4210 over, you come down to $2.90. $2.90 for the cancer rider is $29 a month. So that's how you get to the $62 figure or $63 figure, whatever it is. It is a very, very reasonable product, easy to price out. So that's exactly how I present the program. I write a lot of these, well, not as many as I used to because I don't get out of here very often, but you know, that's the way I do it. And if you guys will follow that guideline, you'll end up making a lot of money selling this product. You'll also have a lot of happy clients if they do get sick and go into the hospital. It's a huge benefit to them and a very, very good program, easy to sell, easy to price. So we're about ready to get into the questions and answers here. Again, here are the states in which this plan is available. Again, if you're in Florida, let us know. We have that available on the Heartland paper. You can sell it in Florida. Down the road, we're looking at California. We'd love to get California out there. There's more than a few senior citizens in the state of California. So it'd be a great, great place. Again, I'm going to leave this up here for you guys to write it down. My name again is Bill Ellsworth. You can reach me at bille@e-hfg.com, or you can get a hold of Kevin Williams. He's our national sales director. He's not the regional director anymore. He's now the national sales director. You can get a hold of him at kevin.williams@equilife.com, or you can get a hold of Ginger Abbott. She will be happy to help you. She's been with us for years, very knowledgeable, good girl. Get a hold of her at ginger.abbott@equilife.com, or you can call us at 1-800-352-5121. And if you need agency services, that email address is right there in front of you. I'll leave that there in case you want to write some of it down. And with that said, Rashawn, if we have any questions.
Yes, we have a couple questions. The first one is, if we get a scope of appointment signed from a Medicare plan, is it necessary to get your scope signed also when selling an Equitable plan?
Well, that's a yes/no answer. It would depend a little bit more on the details. So let me elaborate a little bit. If you're just out selling during the course of the year, January, February, March, April, May, June, July, whatever it is, and you are out calling on people that maybe have sent a reply card in, you do not need a scope of appointment. But if you're in the MA season and they do want to talk about Medicare Advantage, yes, that scope of appointment does need to include hospital indemnity plans on there. Now, here's how I do it. If I have somebody that wants me to talk about Medicare Advantage, they call and say, hey, I know so-and-so, they got a Medicare Advantage plan with you, I want you to come by and see me. I tell them I have to send a form out called a scope of appointment, and on that scope of appointment they need to sign it and date it and get it back to me, and there's going to be 5 little boxes. If they have any questions, call me when they get it and I'll walk them through it, but there's 5 choices up there that they have to sign. And I said, you know, if you want to talk about any of those, you got to initial each one of those. If it were me, I would initial each one of them. That way I can talk to you about those, whether we want to or not. At least we have our bases covered. So I have them initial all 5, mail it back to me. So at certain times of the year, yes, you do, if they want to talk about it during an MA plan. But if you're just out there doing service calls and you want to talk about the hospital indemnity plan, you do not have to have scope of appointments inside.
Okay. The next question I have is, will the lump sum cancer rider ever be available in Pennsylvania?
That's a good question. We are working on it. Some of these states got crazy rules and you have to abide by them. But that's all there's about a handful of states, less than 5 out of all those states that we had on the map that wouldn't let us do that. But we are working on it. We know that's an important benefit. Some of the things that we're working on, guys, is the standalone cancer plans for the lump sum. We're considering drawing up one of those. We could file that in certain states that wouldn't allow us to do that. Again, cancer's so rampant out there, and with all these Obama plans out there, I think you're going to see more and more interest in things like this from the 50 and up crowd, not just the 65 and up crowd. There's so much confusion out there right now. I really encourage you guys to have a great AEP. Anytime there's confusion, there's questions and opportunities. So make this your best AEP ever. If we can ever help you up here, please call us and let us help you if we can. Next.
Okay. The next question I have is, he would like for you to explain how do they handle the effective date and the first premium and draft date.
Couple of different ways you can do that. We will let you post date an application during matter of fact, that's a really, really good question. I'm glad whoever sent that in brought that up, because I should have covered that and I forgot it. During the AEP, we will allow you to write, say that you got a person who has a situation coming up and they're going into the AEP effective 10/15. You can actually go out and start marketing Medicare Advantage plans, but you don't want this plan on the new MA plan. It won't be effective until January the 1st of 2014. You can actually coordinate this program to be effective January the 1st, 2014 also. Just write that in your little box up there. Do not draft. You don't have to pick up any premium if you don't want to. Just make sure you have a void check and say make first bank draft January the 3rd, 2014. That way the effective date, and say make the effective date January 1, first bank draft January 3rd. You can do that way. Now, here's my response to that. That's one way to do it. If you're replacing a Medicare Advantage with another Medicare Advantage, they already have deductibles and copays. I would think you would want to make that effective the day you write the Medicare Advantage. Say you write it on October the 15th. I would go ahead and make it effective October the 15th. A lot of people get sick during the holiday season with stress and anxiety and overeating and things like that. I would want to go into effect then. But that will be on each client's, needs. So you can ask. During the AEP, we'll let you post date 90 days. Outside the AEP, we will only let you go 60 days unless it's a open enrollment to where they are new to Medicare. So if you have any questions on that, email me and I'll put it down in writing for you.
Okay, and this is the last question I have. When will the silver, gold, and platinum sheets be updated to include the statement, if not admitted to ER, that it does cover sickness?
We've already got it done in Florida. We are filing it in all the other states, so probably looking sometime around the end of the year. But guys, gals, as Vice President of the sales department with Equitable Life and Casualty and the vice president of Heartland National Life. You can say you heard it on the damn webinar, and if you ever have an issue with that, you let me know and I'll fix it for you. We have never had a problem with it, but I also understand the need to have that in writing on the policy itself. Again, it is already current in Florida, and we're working on the other states. There's just a lot of other things we're trying to get up with our new med sub-filing and things like that. We've got a couple other projects we're working on. It seems like they're taking precedent over just changing the wording of this plan. I do understand your concern, and we are working on it.
Okay, that's actually the last question I had.
Okay, folks, I appreciate you joining us. Getting you out of here just a shade under 1 hour, that's pretty good for me. I like to talk. So have a great selling season during the AEP. If you need us for anything, we're here. Let us know. We'll work with you any way we can. And best of luck. Have a happy holiday season, and we will talk with you soon.